What about this one? Antihistamines are the only treatment for chronic urticaria.
Well, antihistamines refer to histamine type 1 receptor blockers. Antihistamines is really a general term, but it just means that they block histamine, and they're specifically targeting receptors on blood vessels. And so they are the first line treatment for urticaria. And in all guidelines, H1 antihistamines, preferably second generation non-sedating antihistamines, are considered first line treatment. Not everybody responds to the dose of once a day antihistamines, and so the guidelines actually recommend that you can increase the dose up to 4 times the recommended FDA dose safely. So this is a consensus recommendation, but that again only works maybe in up to 45% of patients, depending on the study, sometimes only 40% of patients. So where do we go from there? And we now have other therapies. Of course, we used to use a lot of treatments before we started having better defined therapies because we had to help patients. And so we used a lot of drugs off-label, but now we have specific therapies that are approved for urticaria. And this has made a major advancement in our management. We use other therapies, but there's a little difference in opinion between certain guidelines, whether we should use medicines like H2 antihistamines. These block histamine type 2 receptors, and leukotriene receptors, which block leukotriene receptors. And these are all released from, again, histamines released from mast cells, as are leukotriene. So the evidence is not as strong. So I think when you talked earlier about guidelines, we try to synthesize or extract all the information from the literature and put it together to create these algorithms, these treatment recommendations. But more recently, we have had some newer therapies, and maybe Karen can elaborate on that.
Absolutely. There's a lot of research ongoing looking at biologics and products that we're seeing the expansion of indications. So very exciting frontier that awaits us.
Yeah, and so I joined that enthusiasm that you have. I think the newer therapies are things like omalizumab, which have been around actually now since 2014. It's a drug that's been around much longer because it was originally approved as asthma, but it's been shown to be very effective in the treatment of different types of hives. And now we have on the cusp of several newer therapies that are currently being investigated that might be approved soon, and that's going to create an even more interesting opportunity to help manage some of these more difficult to treat patients with chronic urticaria.
Ask a quick follow-up question about the antihistamines. I see this a lot online, that people are using sedating antihistamines a large amount of the time and might just be choosing them themselves. Is that something that we're still using according to guidelines?
They're not recommended in guidelines. In fact, they're discouraged because of their effects on sedation. They cross the blood-brain barrier, can cause cognitive problems, especially in older people, and so they're not recommended. They have very good antihistaminic effects, equal to the second generation newer antihistamines, and these are also over the counter, or you can get them through a prescription. But most of these newer second generation antihistamines do not cross the blood-brain barrier. They don't affect the central nervous system. Some have mild effects, but most of them are very well tolerated. There's now several of these that are available in the United States for use over the counter as well as prescription. But this is what's recommended, second generation. What you're referring to is first generation, and like diphenhydramine, which is very sedating and not recommended. We still use diphenhydramine for certain indications, but not for chronic hives.
That's very helpful because I do see an awful lot of that online and social platforms that people are still using that because this is what we all grew up with associating with treating an allergy, right? So, or
Yeah, and sometimes they may not be effective, but they just help them go to sleep. So they can put up with the itching and the swelling, which bothers them, so they can at least sleep and get some rest because they are